views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. Happy New Year. I'm your host, Sonyi Lopez, and today is Tuesday, January 5th. Coming up, founder of Dr. Urgent Medical Care, Dr. Denise Nuñez, joins us to share COVID-19 vaccine updates and recount her experience after receiving the Pfizer vaccine. Then, Councilmember Vanessa Gibson tells us all we need to know about the recent COVID-19 economic relief package and upcoming $600 stimulus checks. After that, we'll discuss Project Parachute and learn how their Fast In program reaches low-income New Yorkers by providing much-needed resources and services to tenants impacted by COVID-19 with community-based organization Enterprise Community Partners. And Bristow Publishing is a publishing house founded and based here in the Bronx. Stay tuned to learn about their books and services to authors in our borough. So please stick around. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. So far, over 68,000 New Yorkers have been vaccinated as New York City continues to roll out COVID-19 vaccines. What are some of the symptoms you may experience? How should you prepare for a vaccine? Answering these questions and sharing her own experience with the COVID-19 vaccine is Dr. Denise Nuñez. She is a pediatric intensivist and founder of Dr. Urgent Medical Care located in the Belmont section of the Bronx. Welcome, Doctora. Thank you so much for joining us today.
Thank you so much for inviting me, Sanji. Thank you.
Claro. So the first thing, of course, how are you doing after taking the vaccine? I know that you got the Pfizer COVID-19 vaccine. Could you just share how you're feeling today and your experience with us?
Oh, thank you so much. So I'm feeling much better now. I'm not sure if the tiredness is because of work or because of the vaccine, but I did get the vaccine of about a week ago, if I can recollect. And I got it a little bit late. It was the day of the snowstorm, the first snowstorm we had. So it was kind of like the snowstorm and trying to get home and, from the hospital. So I received the vaccine that night. Very painful, extremely painful. I'm also very scared of shots, mind you, being a doctor, right? But I'm very scared of shots. So it was very painful, but didn't pay much mind because I was driving and needed to go back home. So that was around 7 o'clock at night. And I do remember going to sleep because I felt kind of a little bit tired, but at the same time, I was what we call post-call. So I was like worked all night and then I got home. So I was tired, but did feel a little bit different, but went to sleep. When I woke up that morning, I woke up with a fever,
Mm.
woke up with huge body aches and I couldn't lift the arm. So I did go to work. I definitely recommend not to do that, but I did come to the urgent care. Actually didn't go to the hospital, and I could not see patients that day. I was literally just doing admin work because the fever would not go down the entire day. So I took a lot of medicine for the fever, which actually hurt my stomach a little bit, but I stayed like that for about almost three full days, with like 72 hours,
Wow.
with fever medication and pain medication. My head was hurting a lot for the 3 days too. Um, then, like by the fourth day, it was like magic. I was back to normal. My arm did still hurt it a lot, but I was much, much better, thank God. So, a lot of my colleagues sort of felt the same. The fever, the headache, the body pain. Added also had more stomach aches, and some sort of loose stools, diarrhea, what we called. So they had that extra that I did not have. And others didn't have anything. Others were fine. So yeah, that was my experience with the
Mm.
COVID.
Thank you for sharing, doctor. And you've also shared your day-to-day experiences since you got the COVID vaccine on social media in Espanol. So,
I,
thank you for that. I know that a lot of people follow you and stay in touch in regards to the COVID vaccine. We're all very worried about, the experiences. So thank you for being honest about how you took the vaccine as a doctor as well. So you said it took over 3 days to overcome the symptoms, and it's kind of common to have these symptoms that you had as well.
so it's kind of common to have anything after you get a vaccine. You know, your body is sort of like working, double working, trying to get all these immunoglobulins, all these antibodies, creating all this. So it's like you're in an inflammatory state. So you're working hard inside. So your body is very, is feels sick. Um, and what Pfizer has shown in their studies is that you do get, you can get these reactions. So these reactions are common when you're producing the antibodies for a vaccine. Some vaccines are a little bit more baby febrile. Um, Flu shot sort of feels the same as kind of feel like you have a cold. Um, for me, I haven't had that reaction. I never had that reaction before, so it was something different, a little bit scary, but I knew it was a vaccine because there was nothing else I did that day. And as I said, other colleagues have had other symptoms come different from mine and almost similar to mine.
Right. And now, doctor, people are fearing a new highly transmissible coronavirus strain. Can you tell us a little bit more about the COVID-19 mutation coming from the UK and
Sure,
what people should know about it?
sure, sure. So first of all, people have to understand that all the viruses mutate. So it's nothing new. It's just new for people to listen to hear that because we don't say it a lot, like doctors are always talking about that. But a little bit of an example of that is the flu shot, right? The flu vaccine. So it mutates every year, and every year we add strains to the vaccine and we get new vaccines every single year. And we don't cover all the strains. Like you literally get a vaccine and you get another mutation. So all the viruses mutate normally. The COVID actually started mutating since the beginning of the year. So I think it's over 17, not 27, but it's over 17 definitely. Uh, uh, Mutations that the virus already had. And in about September, there was a strain found in the south of London that now they know that is definitely more transmittable. So people get more infected. And the way they found this out is that they actually did studies and they swabbed some people with this new strain and they found there's more viruses in the throat and in the back of your nose. It's like the amount of viruses found there compared to other people much higher. And also in November, 28% of the population in England, of south of England, had the strain compared to December, where already 68% of the people had it. So it means that it's just growing very fast. The good thing about this is that now Pfizer and Moderna both have been testing people that already had the vaccine, taking their bloods out, taking this blood to the lab, and injecting the the COVID with the new strain COVID to it, and they're seeing that it is working. So it's mutating, it's stopping the COVID-19. So we don't have to be that worried. Definitely, there's more studies to come. Those are just preliminary studies out there, so it's nothing still set in stone. But for now, the COVID vaccines that we're getting, Pfizer, Moderna, definitely are able to inhibit the COVID-19
Thank you
virus.
for sharing, doctor. And I wanted to also ask, President-elect Joe Biden recently stated that Americans won't be forced to take a coronavirus vaccine. As a doctor, what are your thoughts on this? And should COVID-19 vaccines be mandatory, possibly?
So I don't believe on mandatory. I mean, I think everybody has a right to refuse things, or I'm very more of a team player. I'm an intensivist. I have to work with the team and have to get along with the team. So I have to, everybody has their own concepts of things. So I don't believe things need to be mandatory. I do think that people have to understand what's going on and have to understand what's going on with the population and be informed, right? So what do you want? Like you have to think, well, do you want to get COVID or get the COVID vaccines? You have to sort of think that way. And I know a lot of people are still skeptical about the COVID-19. When they're in front of me, you can't talk much because
Mm.
I'm day to day since this all started on the front of the battle, and working with patients that have died in front of me. You know, we used to have like one person die every, I don't know, every 2 to 3 weeks.
Mm.
And it got to a point that we had like 10 die and you know, just back to back in a day. And when this second wave started, you know, we had like a little recess. We were kind of calmer. We can take a breath in your breather and, you know, eat something, go to the bathroom. And then all of a sudden, about, I would say maybe 3 weeks ago, we were signing out. I was signing out with my colleague in the ICU, and literally we couldn't finish a sign out. It was like 10 minutes into it, and we had like 6 interruptions. We could not like finish the sign out because
Wow.
we can hear the alarms of all the other floors in our in our floor, and it just didn't, you know. And we looked at each other like, okay, here we go again. You know, we have to
Mm.
get prepared. So you know, you have to make that decision if you want to go through COVID. And people say, well, not everybody gets sick, but you don't know if you're going to be, you know, how you're going to react to the vaccine, right? Yeah, to if you get COVID, right? One of the things I actually spoke about yesterday was with my community was that a lot of my kids and my parents have gained a lot of weight, right? And just going a little bit on tangents here, but so you get the idea. Gain a lot of weight with the quarantine, 20 pounds, 30 pounds, just one, and you know, a kid, and it's surprising, right? So our rate of our overweight rate for USA is anywhere from 20 to 40%, 40% adults, 20 to 40 for kids. And one of the things that I realized when all this started, and things that I've learned now with COVID, is that most of my patients that got sick, and not only sick, but got admitted in the ICU and died, most of these patients were obese. So there is a study that I looked at, and I've been looking a lot into all this information, and I read a couple of the studies about 400,000 patients that had COVID. Um, when you compare patients that are healthy to obese patients, and I'm talking about healthy, and I'm not talking about comorbidities, anybody that's healthy compared to just obese patients, 113% of these patients, 113, so all of them got admitted to the hospital. 75% got admitted in the ICU, and over 48% died. So that tells a lot. So that means that, you know, we have to be careful. We are not, you know, most of us are not overweight, but we're not on our correct, you know, healthy weight. And when you're obese, you have, or you're inflammatory, you know, your immune system is depressed because you have your how you call this. Um, I'm so sorry if you can hear the background. I'm in the clinic actually, so sorry for that. Um, the obesity actually creates an imbalance of your hormones and makes you your body inside react like if you have COVID. So you're like a perfect patient for COVID to come in and to have a very severe reaction. So um, I said you just have to look at the numbers, see how many patients, you know, look at the amount of deaths we had already, you know, how many people have died and how many people have been you know, and consequences, not people that are not, they didn't die, but they have a lot of consequences, renal failure, you know, lung failure, patients that needed transplants right now, and a lot of sequelae that all these patients have. So you have to be careful. You have to think very well if you want to, you know, you're going to be exposed to COVID. All of us are going to be exposed to COVID. There's like this, don't believe that in this day and age that you're not going to. Somehow, somewhere, you will get exposed to COVID. So why not be prepared and get your vaccine so at least, you know, you can fight that and not get sick.
And for someone listening now, doctor, are you offering vaccines at your practice at the moment?
Not so it's right now, there are different phases right now. The first phase is a hospital, so they're still on that category and trying to get all the doctors vaccinated. And in the news it came out, there's, I think, only a certain amount of doctors have been vaccinated yet still, so there's still more doctors to be vaccinated. So
Got it.
they need, you know, we're getting more vaccines slowly, the hospital. So that's, I think they need to finish that stage first until everybody else starts getting vaccine.
Got it. And doctor, how can people stay in touch and also visit doctor urgent medical urgent care at this time? You know, for preventative care, I think one thing people need to remember is that they still need to be visiting their doctor and taking care of themselves. As you said, compromised immune system is something that you don't want at this time. So
Yeah.
just any numbers, contact
Yeah, sure.
information that
Yeah, I
people can
think
stay.
what you said was very, very important. One of the issues that we found a lot was that patients were not going to their doctors and they were getting very sick. And then we were seeing them in the ICU were things that they could have, you know, we could have taken care of as a community provider. So yes, please go to your doctors, call them up, see which way you're able to get in touch with that telehealth, whatever it is. I am, as you know, in social media a lot. So Dr. Denise Nuñez is my social media, but the clinic is 347 630-2323. That's the urgent care here in the Bronx and also in Manhattan. So absolutely our pleasure, and we'll, as much as we can, we'll help out.
Thank you, Dr. Nuñez, for sharing your experience with us with taking the COVID-19 vaccine. And I'm glad that you're feeling better now and back to taking care of folks. I know you've been on the front line since the beginning of the pandemic. So thank you. And all the thanks to you and gratitude to you and your all the workers and your crew over at your practice.
Thank you so much. Thank you so much for taking this time and for inviting me. Thank you. That's a pleasure.
We'll be right back with Open BXRX.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, and they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scale of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Trans. Welcome back. More than 9 months into the pandemic, congressional leaders have finally reached an agreement on a second COVID-19 economic relief package. Joining us now to tell us more about upcoming stimulus checks and what the new relief package is exactly is Councilmember of District 16, Vanessa Gibson. Welcome, Councilmember. Always a pleasure having you on the show.
Good afternoon. Thanks so much. Happy holidays.
Happy holidays to you as well. I hope you enjoyed with you and your family. Council members, to start off, let's just get right into it. Can you tell us about the new COVID-19 economic relief package? Just a general overview and how much money has been allocated in total in this package.
Right. So recently, Congress, both the House and the U.S. Senate, passed a stimulus package about $900 billion last week. And the package includes a spending bill to keep the federal government funded for the rest of the fiscal year and really avert a government shutdown. That's number one. And it also provides a lot of relief and protections for Americans. And so there are $600 stimulus payments for adults earning up to $75,000. A family of four would receive $2,400, and the checks are capped at individuals that make more than $99,000. There's an extension of unemployment benefits of up to $300 per week, and the benefit can kick in as early as this week, and it would run until late March of next year. There's an additional $100 a week to dual income earners. There's about $284 billion for businesses to receive the Paycheck Protection Program. There's also money for newspaper, radio, TV producers, about $15 billion for performance venues and independent movie theaters. Senator Chuck Schumer was really advocating for that. And then there's also money that really focuses on the infrastructure. There's about $20 billion to assist states with testing, tracing around COVID-19, $8 billion for vaccine distribution, $82 billion for colleges and schools, about $4 billion for the MTA, which we desperately need, $13 billion in nutrition assistance. I hope that means SNAP benefits and more money for food, farming, and agriculture. There's about $25 billion for rental assistance, $7 billion for broadband access. And then the eviction moratorium was extended to January 31st of next year. It was set to expire this week. And then there's also money for an extension of local and state governments to spend money allocated under the earlier March CARES stimulus package that was passed ahead of the deadline of December 31st. There is a lot in this. $900 billion is a lot of money. But I think obviously where we fall short is supporting a lot of states like New York that have huge fiscal deficits, as well as New York City. And then also, I think a lot of criticism on the actual stimulus payments, because $600 is a smidgen. It's a drop in the bucket. So there is talk, and I do understand that the House introduced a bill yesterday that they passed that would increase that $600 to $2,000 as a one-time stimulus payment. There's no action just yet on the part of U.S. Senate. Senate Mitch McConnell, that still remains in limbo as to whether the Senate will act as well on this amendment.
Thank you so much, Councilmember, for breaking down the allocation of the funds of the $900 billion. $9 billion, is it? 900 billion dollars. Yeah, that is a lot of money. Thank you for breaking it down for us. Councilmember, in your opinion, going back to those individual stimulus checks, is $600 enough to help Bronxites who are struggling with high unemployment rates, rent insecurity, and food insecurity during this pandemic? What is your opinion on that?
Absolutely not. It's a slap in the face. $600 stimulus payment isn't enough to even meet monthly rent. I don't know anyone in our district of the Bronx, even those that have a studio apartment, that pay $600 a month in rent. So it doesn't even meet a lot of the minimum necessities that families need today. And you talked about food insecurity, the high need to get residents access to healthy food, paying your rent, paying your mortgage, providing stability for your family, a roof over your head, clothing on your back. I mean, none of that. $600 is a down payment. And I think many of us are looking for the remainder of that payment, because it's been months since we passed the CARES Act months ago, and there's been no relief provided. There's been so much of an impasse at Congress between the House and the Senate. Obviously, we had to get through the midterm elections, the election of the incoming president and vice president. And so now that all of that is behind us, I think a lot of us are very focused on Georgia, on the 2 U.S. Senate seats that we need to capture and turn blue. And then ultimately, we will have the majority of the U.S. Senate in Democratic control.
And as you stated, Councilwoman, the House and the House just recently overwhelmingly voted to raise the stimulus check payment from $600 to $2,000 after Trump's proposal, I believe it was.
Yes.
And this now leaves the action to the Senate, as you said. What are your thoughts on this, and what is the likelihood of another stimulus check coming through in the next couple weeks or the next couple months?
Well, I want to applaud House Democrats, particularly the New York delegation, all of our amazing members of Congress that represent us in New York State. I thank them for their leadership and joining with all of their colleagues in the House to really support this. I think it's meaningful, it's significant, and it really does send a message, a very loud message, that it's time for the federal government to step up and show us that they not only care about Americans, but they are in leadership positions to help America rebound from this COVID-19 pandemic that has hit Americans the hardest, Americans of color, low-income families, homeowners, small businesses struggling, closing, can't meet payroll, can't survive, no customer base, cities shutting down, COVID cases are rising. I mean, that's what we've been living with since March. It's really real out there. And I need, the members, not just in the House, but in the U.S. Senate, which is where we have the impasse. So it is my hope and expectation that a lot of pressure will be put on Senator Mitch McConnell and his leadership team, and the U.S. Senate does act. The amended version, I think, is obviously much better. $2,000 is much, much better. That can allow a family to pay their monthly rent. Many of them are behind months in rent. And so we know, again, it's short-term relief for long-term problems. But I think $2,000 sends a much louder message to the country that we care and we are ready and able and willing to help Americans during their greatest time of need.
Absolutely. And as we all know, the last check anyone received was about 8 months ago. And leaders on both sides have been negotiating and compromising for months now on this second relief package, which was just passed. To put it plainly, Councilwoman, what exactly took so long for this new package to be passed?
Politics, elections, campaigns. I think all of that very relative in this year of a presidential election in which, we, the Democrats, really wanted to overturn and get higher numbers in terms of record levels of voter turnout. I think it speaks volumes to a lot of the issues that we fundamentally believe in and we care about and want to be addressed by the presidential administration. And I think people are waking up. They're frustrated with this president. They have seen, the divisiveness, the rhetoric, a lot of his tactics that have not been productive nor beneficial to Americans, everyday Americans, and certainly New York State. He's not been a friend to our state, to our city. He's been critical of the governor, the mayor. He uses Twitter to attack and criticize everyone. No one can lead a country like that. And I think everyday Bronxites have seen that. And that's why they came out in record numbers back in November. And so putting all of that together in the middle of, an election season, a presidential race, the political climate, the landscape, that's why you had this impasse and why so many months have passed since we saw the last stimulus payment. But I think the time is now. We're ending this year on a very painful note. We've lost thousands of Americans, thousands of New Yorkers, thousands of Bronxites, predominantly older, underlying health conditions, people of color. We have to show leadership and we have to end this year with some level of optimism, right? People have to hope that things will get better. Give us something to go on. Give us a chance to say, you know what? We've seen what we've endured all this year. And now here's a stimulus check. Here's support for your businesses. Here's eviction prevention. Here's rent relief, tax relief, support for transportation, test and tracing, COVID-19 testing. Give us something so that we can hope for a better tomorrow and a brighter new year.
Right. Sounds like wishful thinking, and I hope that that does happen in the new year. I wanted to go back on the allocation to tenants as well, Councilwoman. According to the Aspen Institute, nearly 40 million Americans could face eviction over the next several months. Will $25 billion in rental assistance be enough to help prevent these evictions? Well, what are your thoughts on that?
I don't ever think it's enough. I think it's a step forward. It's a level of progress. It's a start. It should not be the end. It is the floor, not the ceiling. We should always aim high and improve. And I'm hoping that our incoming President Biden and Vice President Harris will lead by demonstrating that we need more support on rental assistance, even right here in New York, even right here in New York City. We believe there are 30,000 pending evictions starting in June of this year. Landlords waiting to evict tenants who are months behind in rent, who've lost income, lost employment, and they can't meet rent. Even the first stimulus payment of $1,200, you can pay something towards your rent, but you can't cover the whole amount. So a lot of people have rental arrears. Those that have been and are able have been able to pay their rent, but a lot have not. And we realize that. And I also want to recognize the homeowners that struggle too. We don't talk about homeowners and co-op owners and residents that own their apartment. They're struggling too. And, some of our small time landlords, they don't own thousands and thousands of units of housing. They are small landlords that are predominantly landlords of color. They've reached out to my office and they're struggling and they feel like no one is giving them an outlet. And I think all of this is very relative to the efforts to prevent eviction, to provide legal representation and assistance on the ground. What we've done with our Right to Counsel in New York City, we've pushed and we want to expand to all zip codes in New York City because we know the need is there. We want to prevent evictions on the front end so people don't end up homeless in a homeless shelter because of COVID. And thankfully, the legislature yesterday just passed the Eviction Prevention Act, the Foreclosure Act, which I'm very proud of, and shout out to Senate Majority Leader Stuart Cousins and Assembly Speaker Hasty and all of the leaders and members of the Assembly and Senate for passing a very comprehensive bill that really has all of those components. It helps tenants, it helps renters, it helps homeowners, and it helps small-time landlords, because we don't want to forget about some of these partners that are providing a service in terms of housing, but they're struggling too. So again, I think everything is a step forward, but the $25 billion in federal assistance is, again, it's a step. It's not the only thing we should be getting. We should take it and use it to expand and cover as many people as we can, but we also should be demanding more in the new administration when they reconvene back in again in January.
Yes, thank you so much, Councilmember. And I'm glad you brought up that the Emergency Eviction and Foreclosure Prevention Act. It's allegedly, well, it is the strongest bill in the nation to block eviction proceedings from going forward. So proud to hear that that was just passed. Thank you again for your time, Councilmember. Before we go, can you close with a little message to Bronxites for the new year? This is airing on January 5th, so it'll air after the new year.
Sure. Hello, Bronxites. I wish you and your families a healthy and happy new year. We are in this beautiful new year of 2021, and we have an opportunity to do so much better. 2020 was a hard, challenging, painful, heartbreaking year for many, many of us. We've lost family members, friends, neighbors to COVID-19. It has been a real setback for us in the Bronx. But if you understand, every setback is preparation for a comeback, and we have to come back this year better than ever before, with optimism, with hope for a better tomorrow for our children, for our families. So we are going to work together. We are going to be united like never before, because we are all in this together. Happy New Year to you and your families. And I pray that you have a prosperous, healthy, happy, and productive 2021. Feliz Año Nuevo. Happy New Year to everyone. God bless you guys.
Folks back at home. According to the Treasury Secretary, Steve Mnuchin, since the new stimulus bill sets a January 15th deadline for the IRS to send out payments, people who will receive their second stimulus check in the mail, either as a paper check or prepaid debit card, should look for the payment in the first 3 weeks of January. We'll be right back. When taking public transportation, don't touch your phone. Carry hand sanitizer and use it immediately upon leaving the bus or train. Avoid touching your face. If someone is coughing or sneezing, move away. Wash your hands with soap and water as soon as possible. Limit contact with poles. If possible, avoid rush hour. Don't eat or drink on public transportation. Keep your bag off the floor or other surfaces. Avoid directly touching turnstiles. Stay up to date with the latest from your local health department and CDC.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Recently, the Senate Democratic majority announced the passing of a COVID-19 Emergency Eviction and Foreclosure Prevention Act, the strongest bill in the nation to block eviction proceedings from going forward. Months ago, Project Parachute, a philanthropic fund, began working with community-based organizations like Enterprise Community Partners to reach low-income New Yorkers and provide much-needed resources and services to tenants impacted by COVID-19. Joining us now to share more is Michael Collins. Michael Collins is the Senior Program Officer of Most Vulnerable Populations at Enterprise Community Partners. Welcome, Michael. Thank you so much for joining us today.
Thank you for having me.
Of course. Just to start, can you tell us more about Enterprise Community Partners and your mission?
Absolutely. So, Enterprise Community Partners is the only national nonprofit that addresses America's affordable housing crisis from every angle. We really have worked to combine 40 years of experience, thousands of local partners, and expertise from over 1,100 employees nationwide. Our mission is simple, and it is just to make home and community places of pride, power, and belonging, and platforms for resilience and upward mobility for all.
Thank you, Michael. Can you share more about Project Parachute's philanthropic fund and why your nonprofit decided to join this initiative?
So, Project Parachute is a coalition of property owners, nonprofits, and city agencies committed to helping vulnerable and underserved New York residents stay in their homes as the COVID-19 crisis continues, and do so through its program Fasten. Funds and services for tenants experiencing need, which offers eviction prevention services and financial resources, including rent relief. The initiative was seeded by the Real Estate Board of New York and the New York State Association for Affordable Housing, with over $4.4 million in philanthropic support from more than 30 property owners, with the explicit goal of expanding the capacity of community based service providers to deliver eviction prevention services. That includes supports and services for those who would otherwise slip through the safety net, including undocumented immigrants and shadow economy workers. To date, Project Parachute has raised about $11.6 million through additional philanthropic funds toward a goal of about $15 million. We in getting involved, we wanted to support New Yorkers in the wake of this unprecedented crisis, which has had a disproportionate impact on communities of color and people of color who have already faced housing insecurity before the crisis. These groups also, as we look ahead, are being disproportionately impacted by COVID, both health-wise and economically. Additionally, this program is something that really plays to our strength and our ability to really manage cross-sector collaboration and to really develop innovative programs.
And thank you, Michael. And as we know, we're 9 months into the pandemic right now, and many tenants are fearing eviction throughout the pandemic. How does this fund aim to protect tenants even after the eviction moratorium expires?
So the eviction moratorium is really critical for immediate security. And also, we have to acknowledge that this is a temporary fix as arrears are building. The buildup in arrears really put renters at risk of eviction once the moratoria is lifted, as well as puts the city's affordable housing stock at risk of deterioration. The primary goal of Project Parachute really is to ensure that New Yorkers remain in their homes by providing immediate financial assistance and mediation, as well as connections to resources and services that can help families stabilize more long term. While the programmatic components of the initiative definitely connect tenants to supports and financial resources, the initiative also supports advocacy efforts to increase funding for rental assistance and for more equitable, humane eviction processes. It's simply just not enough to ensure that someone's arrears are covered, but we, through Project Parachute, are working to foster practices and promote policies that halt the eviction process early and foster greater partnership between tenants and landlords that keep people in their homes.
And who qualifies for the Fasten program? Let's say someone is listening right now and they're interested in inquiring about this service. Who can qualify for it, and how can they reach out to Project Parachute?
Okay. So Funds and Services for Tenants Experiencing Need is a program that provides clients with, again, rental arrears assistance and landlord mediation, legal assistance where needed to help them remain housed in the immediate crisis once this eviction moratoriums are lifted. It also helps them to stabilize more holistically with resources like food relief, affordable health services and utilities, arrears assistance, and helping them to sustain stable housing through access to financial counseling, job search assistance, and other referral services. Individuals and families who would be eligible for Fasten services include those who have income that is no more than 50% of the area median income, or AMI, those who are experiencing housing instability, such as an inability to pay rent fully, and have experienced a negative COVID related financial impact, such as a loss of income or an increase in expenses. I think one thing that I want to highlight about the program is that anyone who meets these requirements can receive assistance regardless of immigration status or employment status through nonprofit providers.
And Michael, how have the funds been distributed, and what percentage of these funds went to the Bronx, here in the Bronx, in this borough?
Thank you. So the distribution of funds to providers is really based on a number of factors, including COVID impact, housing stability, and impacted industries within each provider service areas. Neighborhoods in the Bronx were among the hardest hit by COVID, and so the borough received the largest allocation of funds at 30%, 32% of resources raised for this initiative have been awarded to providers in the Bronx.
That's wonderful to hear. And the initiative is still going on for folks that need the assistance as well, if I'm not mistaken.
Yes, it is. Yes.
And Michael, can you tell us about the importance of working with and serving the most vulnerable, including undocumented immigrants, through your services?
Yes, so Project Parachute and the Fashion Program, in their inception, were really an attempt to provide much needed supports and services to those who otherwise have no resources available to them. Project Parachute enables community-based nonprofit provider partners to really reach people who are not eligible for other forms of public assistance, including undocumented workers and those in non-standard employment, as identified by providers.
Thank you, Michael. And as we stated in the beginning, the Senate Democratic majority recently met to pass a COVID-19 Emergency Eviction and Foreclosure Prevention Act. What does this act mean, and how is your organization feeling about the future and security of tenants in New York City?
So since the beginning of the pandemic, eviction moratorium have been vital to keeping people safely housed and out of housing court, despite the unprecedented economic vulnerabilities and housing instability. We applaud the state legislator and the governor for their leadership in passing the Emergency Eviction and Foreclosure Prevention Act. This act is a necessary step forward, replacing the patchwork of legislation, executive orders, and court actions with more comprehensive protections for renters who have suffered financial hardship and property owners who are having trouble covering the cost of utilities and maintenance. However, this legislation, like all eviction moratoria, is a temporary measure that stalls rather than prevents an eviction crisis. This legislation does not address the buildup in arrears, a critical component of keeping people housed long term. And really, unless these arrears are addressed by expanding access to new and existing forms of rental assistance, tenants will still be at risk of eviction when moratoria end, and the city's affordable housing stock is at risk of deterioration.
Right. So thank you, Michael. Before we let you go, how can people stay in touch and find out more about Enterprise Community Partners and Project Parachute? Is there still time to apply? If so, can you please share how people can apply?
Absolutely. So you can learn more about Enterprise and Project Parachute by visiting the website, www.projectparachute.nyc. There is still time to apply, and we are encouraging folks to do so now, despite the moratoria. Impacted tenants can access Project Parachute assistance through the 7 community-based partners who are also New York City's home-based providers. They can do so by calling 311, visiting the Project Parachute website, or by contacting their local home-based provider directly.
Wonderful. Thank you so much, Michael. I know one of those partners is BronxWorks, our very good friend here at BronxNet. So if folks can call 311 and get that information, that would be great. Michael Collins is a Senior Program Officer of Most Vulnerable Populations at Enterprise Community Partners. Thank you again for joining us today.
Thank you.
Again, you can visit projectparachute.nyc for more information and enterprisecommunity.org. We'll be right back.
most at risk for coronavirus. People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. Bristow Publishing is an independently owned boutique publishing house based right here in the Bronx. So far, they've published family-friendly titles such as Fernando the Bodega Cat, a children's book about diversity and inclusion, and Generational Wealth Building, a fun financial literacy workbook. Joining us now to share more about this publishing house is Leslie Dangerfield. Leslie is the co-founder of Bristow Publishing. Welcome, Leslie. Thank you so much for joining us.
Thank you for having me.
Of course. And for those who are not familiar, can you just tell us a little bit more about the publishing house that you co-founded and your mission?
Well, Bristow Publishing is a publishing house that is independently owned and operated. We're based right here out of the Bronx, New York, Bronx native. And our mission is to really kind of share stories that are often neglected and really allow more accessibility to publishing. And we believe that everyone has a story, and we really want to help people who are, kind of traditionally disenfranchised from publishing, to give them a platform and push people to share.
That's wonderful. And Leslie, what inspired you to start Bristow Publishing here in the Bronx in particular?
I kind of had experience with publishing. I always had experience with publishing and freelancing. And I decided to kind of push my own book out. And in doing so, I kind of realized, I can do this myself. And when I started doing that, I was approached by other people who kind of had a lot of questions and kind of was looking for insight on publishing their own work. And so the idea of just starting our own publishing company kind of came about.
That's wonderful. And Bristow Publishing has, of course, published several books already, and I'd love to share them with our viewers. One of those books is actually your first book about a familiar neighborhood character. Can you tell us a little bit more about Fernando the Bodega Cat?
Sure. So Fernando the Bodega Cat is actually, it's inspired by a real life bodega cat, like right down the block from my house. And the bodega owner was completely stoked when he saw like the illustrations in the book. But it is, I think bodega cats are a staple in Bronx culture and New York City culture at that. And there's so many interactions that happen in the bodega. And so that's what the book is about. It's about the cat, but it's about so much more. It's about the diversity and the inclusiveness that comes, in New York City neighborhoods that are highlighted with the interactions with the cat. So
I loved it. I got a little sneak peek and I enjoyed the writing. I enjoyed the diversity in the book. I don't want to give too much away so that the viewer can go and purchase it. There it goes. Look at it. Fernando the Bodega Cat. And is it available right now online, Leslie, in case somebody's listening and watching us and they're interested in learning more?
So Fernando the Bodega Cat is available online, and it's available on Amazon right now, and it's also available at Barnes and Nobles.
Thank you. Another recent publication that you have is Generational Wealth Building. It's by a father and son duo, and it's already a bestseller. Congratulations on that. Can you tell us more about their book and why this book is important to share cross-generationally?
So we have, it's King and Kyron. Shout out to King and Kyron Gibson. They're a father and son duo that went viral earlier this year for displaying his son's knowledge of financial literacy terms. And they saw a need kind of to educate the community about, financial literacy from an early age. Statistically, Black people are less likely to own a home. They're less likely to have, pass on generational wealth, have less net worth than, families that are not Black. So they saw a need, and it was fun and engaging, and it's a fun-filled workbook. I actually have a copy here. This was and it's 51 pages. It has mazes, and it really breaks down kind of complex financial terms into a way that's simple for kids to understand. And promote smart financial habits from an early age, such as saving, budgeting, and managing their allowance. So, it's always great to start good habits early. So.
Absolutely. And I love that. Shoot, I need that book. I'm not even a kid. Like,
a lot of adults are actually buying it, and they're saying that because it's so simple and easy to understand, it really kind of helps them grasp a lot of financial terms as well. So that's a lot of feedback we've been having from adults. Like, this has been helpful for me. So we're really glad it's available for everyone. The recommended ages is, 8 and up, but I mean, it's available to anyone who wants to get an early start and kind of just get clarity for finances. So we're happy.
And that book is also available on Amazon, Leslie?
This book is also available on Amazon, and this is the first in a series, so there will be more generational wealth building activity books coming along to kind of break down other financial concepts such as money management and entrepreneurship. And we also have an app coming out as well. So King and Chiron have a flashcard app that's a supplement for the wealth building activity book. So we're excited to release that soon.
That's amazing. Thank you so much for sharing. And I also wanted to learn about some of the services that you offer Bronxites as well. Do you also provide publishing services for authors and aspiring authors here in the Bronx? How can people inquire about any services?
So we are on Instagram. We are taking submissions for manuscripts. We're on Instagram. If you go to the link tree on Bristow Publishing on Instagram, there's a link for manuscript submissions. So any aspiring writers, you want to publish your novel, you can submit it to us. And even in the event that it's not a good fit for our publishing company, we still want to help people publish their book. Anyone can share their story. It's difficult, but it's not impossible. So we want to promote people to share. We're actually working with a couple organizations now to kind of do some self-publishing workshops and kind of teach people how they can go about publishing their own books and, promoting their own books. And I think that's an advantage that people have now that, they can take advantage of. Like 15 years ago, it was like impossible to get a book in like a Barnes and Noble's kind of store. And now, the publishing industry has changed so much where, you have access to these places where you previously didn't have access to. So yeah, we want to help everyone share their story.
That is so true. And a lot of these workshops are going to happen online, I'm guessing, virtually?
Unfortunately, because of COVID, yes, they're going to be virtual, but that's great because that means more people can have access to them and join in. So follow us on Instagram, Bristow Publishing, keep in touch, and you'll, find out about all of our events as they're happening in real time.
Yes, thank you, Leslie. Something else I wanted to talk about was about representation, not only in books, but also in publishing, not only in like the literate, in the writing, but also in like the people that are writing these books. Can you tell us about the importance of highlighting that through Bristow Publishing?
Absolutely. I feel like there is a void. There was a void, and there kind of still is a void in publishing and the traditional kind of publishing setting. And I hear that a lot from even writers of color who have worked with traditional publishers, that they express a want for diversity and they want stories from, the marginalized communities. However, they want to edit out certain pieces that make these stories what they are. And I hear, a lot of frustration from writers who kind of want to be censored by people who don't look like them, but want to tell them how to write their story. So again, this is why we started Bristow Publishing, to give a platform for people to share their stories as they are, and put faces that you don't normally see and stories you don't normally hear, and give them a platform for everyone to kind of hear and make a decision about literature. So we are with the with the Independent Book Publishers Association. So we do our best to kind of keep with industry standards and make sure that we're delivering quality work, but also a diverse range of works. So
thank you, Leslie, for sharing. Super important and inspiring to see that you're bringing this to your borough, a publishing house here in our borough, the Bronx. What can get better than that right now? I also wanted to ask you if you faced any challenges with establishing this publishing house on your own here in the Bronx as well. If you can share anything that, maybe was an obstacle in your way, or if it's just been all good the whole time.
Nothing is ever all good, but it's been a learning process for sure. I've been fortunate enough to have some mentors. And again, I'm not, I do have partners that I work with as well, who's also been very supportive and also wanting to see this mission through. And, everyone kind of gives feedback on projects and we collectively come together. But I think, the most important part is just really just sticking to the goal and kind of, doing what we set out to do, and the rest will come. Like when you do what you feel is your passion, then, things will eventually fall in place. So it's been a learning process. We're still learning, we're still growing, we're still expanding. And, hopefully this is just the beginning. So, we'll see where 2021 takes us. We're looking, we have some, I can't share it right now because we're still under contract, but we've got some, really great projects lined up for some, Bronx sites that you guys may know of. I'm sure a few have been on your show. So I'm excited to unveil those in 2021. And what else? Fernando the Bodega Cat, actually, shout out to the BX Writers and Josue from the Bronx Native Shop. Host Fernando the Bodega Cat is going to find a place on the BX Writer shelf. So, we really want to support Bronx businesses as well and Bronx sites. So again, check out Bristow Publishing on our Instagram, go to the link and submit those manuscripts and we'll help get them published.
Thank you so much, Leslie, for joining us today and for telling us more about Bristow Publishing.
Thank you for having us. Really great. And keep doing what you do. We love you.
Thank you all. I love you guys too. It's great connecting always. Thank you so much. Again,
really quickly, before I forget, I have something for you. I mean, I can't see you in person, I hope, but I'm going to put it in the mail. I want to show you before we end this. So this is for you.
Oh, I get a little
Fernando. A little bodega cat to take with you. So yeah, I'll mail this to you when you get it and you can have your own little Fernando.
I love it. He actually looks like my cat. My cat's name is Cheeto, and he's like kind of not a tuxedo cat, but he has like the white paws and he's black on top.
Gotcha.
I love it. Thank you so much. I can't wait to get it, and I can't wait to share Fernando the Bodega Cat with everyone else. Thank you again, Leslie.
No problem.
Leslie Dangerfield is the co-founder of Bristow Publishing. And again, you can find Fernando the Bodega Cat and Generational Wealth Building on Amazon. Follow at Bristow Publishing to keep in touch and visit bristowpublishing.com for more information on this Bronx-based publishing house. That's all for our show today. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Happy New Year to everyone.